My name is Kristina Michele Martens, and I have been working with Chuckanut Health Foundation for about 5 years on a multitude of different projects. My position is the Special Projects Coordinator with the Chuckanut Health Foundation, and that means I actually get to manage the Health Equity Zone, which is in East County. The Health Equity Zone is a brand new initiative from the State Department of Health. They chose 3 zones in all of Washington State, and the area that is designated the Mount Baker School District is the only rural zone in all of Washington, kind of reinventing how government works for a community. The mission of the Health Equity Zone is that it has become apparent that not all communities are treated fairly and equally. And here in Whatcom County, we specifically know that East County, all of the Mount Baker School District, doesn't have a lot of access to resources at all, truly. And so the Health Equity Zone is about really giving power back to the people. It's about understanding the issues that a community is facing every day from their perspective, in their words, and then working with that community to listen to and try to help bring to life the solutions they actually want to see. Because the people living the problem, the people who are closest to it, always have the most reasonable and realistic answer. And the Health Equity Zone helps to empower a community to bring those to life. Chuckanut Health Foundation, who is holding the contract for the Health Equity Zone, is just really dedicated to the holistic health of a community. And with Chuckanut Health Foundation, we really believe that is upstream. Instead of catching people at the end of the river, how do we stop them from falling in? And when we're thinking about how to make the biggest impact, a conversation we have a lot internally is about trusted adults and really giving an outlet and a resource to children. That yes, it's great to have your parents and your caretakers who are in there in your sphere, but trying to give children and youth the best possible avenue forward in the world is also giving them touch points outside of their direct sphere who they might be more comfortable talking to, or they are able to talk about topics that they don't really want to get in with their guardians, and just having a friendly face that is, yes, an adult, but maybe a little bit more connected in the pop culture, the everyday that is happening and swirling around a child or youth when they're actually out in the world. And communities and schools, Whatcom-Skagit County is just that. It is bringing trusted adults into schools, allowing the youth to have a trusted adult that they can turn to in a place where they spend a fair amount of time. My biggest hope for communities and schools, Whatcom-Skagit County, entering into the Mount Baker School District is that a bigger sense of community is built. The Mount Baker School District is 522 square miles with about 15,000 residents. That is a lot of space for only 15,000 people. And just the geography of that area makes it hard to connect with your neighbors and with your community. And so allowing another avenue in the Mount Baker School District where more people are coming in, more ideas are coming in, and more trusted adults whose sole focus is to build those bridges and really try to help weave the community together. Very often it does take, at least from my experience, someone with an outsider's perspective to just kind of question, well, why are we doing it this way? Or why are we doing it this way, and what is the outcome and impacts of people we're not reaching, of community members we're not being able to serve? And so just inviting new life and new eyes in a community that is so spread out, I think it's going to do wonders to create a sense of hope. While the Health Equity Zone is a wonderful opportunity to really put people in the center of how a government moves and operates and responds, it is only a 3-year initiative. And so as we move into the 3rd phase, the 3rd year, we do, with the Health Equity Zone, have 1 more year, which is great to keep building on our momentum. But when the initiative is over, we really hope the community has had the opportunity to build the scaffolding and hopefully even a foundation to keep the work going that we are able to launch through the Health Equity Zone initiative. So partnering with communities and schools of Whatcom-Skagit County seems like the perfect way to be able to bring in new allies and partners and advocates so that the work done during the Health Equity Zone can still move forward. Through this initiative partnership with communities and schools and the Health Equity Zone, we're hoping to really bring to light the fact that there are amazing entities doing incredible work, not only all around the Mount Baker School District, all around Whatcom County, all around Washington State, but we need buy-in from a community to really elevate these things and make sure that we're able to secure funding for the longevity of such an important new opportunity for the Mount Baker School District. And times are tough everywhere. We are all at least slightly paying attention to the news, and to a certain degree, we know that funding streams have really been turned off at the federal level. So if we want to ensure that our communities stay healthy, that our children and youth have trusted adults around them as much as possible, we as a community have to look internally and decide what is worth the cost and what is worth value. And I truly believe that being able to introduce this program in the Mount Baker School District will not only show so much value within the first 1 or 2 years, but again, the foundation that it's setting for decades to come of really bringing cohesion and a sense of true community and just other people working for the best of what Mount Baker School District can be. It's kind of a no-brainer at this point in time.